Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hello, you're watching The Print. I'm Sravasti Dasgupta, and today we are going to talk about how the coronavirus pandemic has affected doctors who are our frontline workers in this pandemic. Now, the Indian Medical Association on the 8th of August shot off a letter to Prime Minister Modi stating that nearly 200 doctors have been killed on the front lines while fighting this pandemic. Joining me today is Dr. R V Asokan, who's one of the signatories of this letter to the Prime Minister, and he's joining us today to talk about the kind of challenges that doctors are facing in this fight. Dr. Asokan, welcome to The Print. My first question to you is that earlier this month, the IMA had written a letter to the Prime Minister saying that according to the data collected by you, 196 doctors have been killed on the front lines while fighting this pandemic. I just want you to give our viewers a sense of what are the findings that you have found in your report and what this means.
Well, when the pandemic began, it was a challenge to actually find out how many doctors are getting infected due to COVID-19, as well as how many are losing their lives in duty of the nation. So we formed a registry, a national registry, IMA COVID registry, and started collecting data from almost all the districts of the country. Indian Medical Association has got a branch almost everywhere in the country, in all the districts of the country. And we have a very active junior doctors network, which has enabled us to collect this data from almost all institutions and from private practitioners. Unlike in many other countries, we found that doctors are falling like nine pins. And as we wrote to the PM, after that, now it is going to be around 2 weeks. The death toll right now is 273. Our doctors was to take care, follow scientific guidelines, infection protocols, and take care of them and their staff. The primary writing of letter to the Prime Minister actually was to bring the attention of our members rather than the Prime Minister.
You are saying that right now the toll has reached 273. That's a massive number, doctor, that you're giving us at this point of time. Have you got any response from the central government, from the Prime Minister's office on the letter that you had written about 2 weeks ago?
Not yet. We hope we'll be receiving an appropriate reply from the Prime Minister. He cares, and we know that an appropriate response will come. We have put up to the Prime Minister mainly two issues. One is, at least in few places it has been reported, admission was denied to them in some of the institutions. So this is one area where we wanted to bring it to the attention of the Prime Minister, that which is to say that to ensure appropriate medical care. Second, the Prime Minister was kind enough to sanction an amount of 50 lakhs rupees for the family of the doctors who had lost their lives. But this is unfortunately confined to the government sector. But in our statistics, we find that a lot of doctors have died in the private sector. So COVID does not differentiate between private or government. So it's our appeal to the national government that the national government also should not differentiate when compensating doctors who have died in the national duty.
Right. I also want to get to the point that you have mentioned in your letter, sir, that you have said that the mortality rate among doctors has reached an alarming proposition now. If you can give us a sense of what exactly the mortality rate among doctors is according to your findings, and why do you think it is so high among doctors?
Well, the cutting across the sectors, private, government, residents, house surgeons, it's around 8%. 8% of the doctors are getting, when they get infected, they die. And amongst private practitioners, it's still higher. It's in double digits, somewhere above 15%, which is very unacceptable. 15% among the general practitioners, which is very unacceptable. Among the total deaths of the, if 190 patients die out of COVID, one is a doctor.
Very important point that you're raising there, sir. So that is why I want to ask you that first of all, this report that you have taken out, which has been annexed to the letter that you have sent to the Prime Minister, we've had a chance to look at that report, and that tells us that most of the doctors' deaths have been in the states of Tamil Nadu, Maharashtra, Gujarat, and Bihar.
7th of last month, we had sent a letter to the Prime Minister, but we had only given the numbers, we had not given the names. Because of the concerns of the privacy of the doctors and their families, we had not given the names. But when we found that this was not evoking appropriate response, we put them all the names of the doctors for the governments to verify. As a matter of fact, some of the states have taken it seriously also. They have followed it. They have followed it as, even to the extent of verifying the death certificates, whether they are RT-PCR positive, whether it was CT which was used. I think some response has come, and some of the governments have taken up the issue seriously, at least the compensation part. Right now, we cannot do anything about whoever has died, excepting to see that their families are supported like the soldiers who fall in a war.
So I'll come to that bit about what needs to be done for them in terms of more than compensation. We'll just come to that in a bit. I want to draw your attention to why do you think there's such a high mortality rate among doctors? Is it the lack of PPE, which is personal protective equipment, or the lack of mechanisms in government as well as private hospitals that are making doctors more prone to the virus? Yes, they need to be close to the patients, that is correct, but are we not equipping them enough to be able to fight this pandemic?
Well, this mortality is partially from the earlier weeks of the pandemic also, where we did not know much about the virus. What's the importance of day 9 and what should we look for at the end of the second week? So we know but that much of information was not available in the early days. Let me congratulate the government for providing good quality PPEs available to the entire country in a matter of few weeks. They moved everything to see that the PPEs. Of course, there was some mismatch in some places, but I think at least the government institutions and the COVID hospitals were certainly well protected, which reflects in the very limited mortality in the government sector. What really happened is, before a person is determined as a COVID or non-COVID, patient comes with the fever and body pain, and they go to their neighboring clinic, neighboring doctor who has been their family doctor or the general practitioner who is near them. So it's on the second day, third day, fourth day. These are the days which are highly infected. The general practitioner's cabin is normally very small, perhaps not well ventilated also. And the doctor normally spends some quality time, physically examines the patient. PPEs, as prescribed for a OPD session, are limited to N95 and perhaps a gloves or a hand washing protocol. The gloves, by now we know, is preferable to have a proper hand wash after each patient. So I think that is what has been scientifically also approved. But the issue in a small OPD clinic is to trade, to segregate patients. Where they come in, they may be waiting 2 or 3 persons, even they are waiting in a small clinic. That creates difficulties. So that might have been the initial causes.
They are the general practitioners, the neighborhood doctors who are the first point of care that patients go to in terms of when they complain of a fever. So now your findings say that about 40% of the total number were above 50. So that you have said is the high risk group, and your letter has also sought specific care for that high risk group. But I want to draw your attention to the fact, sir, that the WHO has recently said that the age group that is driving the pandemic is now between the 20s to the 40s. So but your letter is asking for special protection for the high risk group, which is above 50. So do you think that we need to look for umbrella protections across age groups for all doctors and not specify or restrict it to a certain age group, sir?
Okay, the first thing regarding the WHO, India is a big country. The pandemic differs from district to district, leave alone the states. It's a very dynamic situation, and a WHO statement has to be customized to apply to our country. It differs. So I think we cannot take a WHO statement on the face of it. Maybe they are predicting things. Our statistics shows right now, among the 273 doctors as of yesterday, 226 are above 50. 226 are above 50. It's not 40%, it's much more than that. So this 226 may have had comorbidities. Right now, we know, though there might have been a lot of comorbidities, it is the diabetes mellitus which has been doing the damage in many of these cases. As per our data, we have 1,965 doctors who have been infected.
Okay.
Out of which the practicing doctors are 901.
Okay.
So out of these 901 practicing doctors, we have a large number of them, about 200, who have died. The resident doctors, 768 have been infected. House surgeons, 296 have been infected.
So, do you think that this pandemic finally presents an opportunity for India to overhaul its healthcare system completely?
Certainly. It's a blessing in disguise. One, we have been demanding for a very long time to restore the GDP expenditure on health, which was around 5% in the initial years, to 6%, or at least 2.5% many times. It hovers around 1.1% public health expenditure. And 4.5% of GDP comes from the private healthcare and for-profit healthcare. So I think it's a good time to look at, invest more in public sector institutions. You will have to now realize that public health infrastructure was the steel frame on which India has fought. We would have collapsed like many countries had we focused only on for-profit tertiary care institutions. So what has stood up for India is public health institutions, public health human resources, and that has to be strengthened. And I am sure that message has been well learned.
All right. So India's public healthcare institutions need to be strengthened, is what the Indian Medical Association's General Secretary, Dr. R V Asokan, is telling us today. Thank you so much, Doctor, for joining us on The Print. That's all that we have for you at this moment. Thank you so much for watching.